Azithromycin tablet is used to prevent and treat a very serious type of infection called mycobacteria or MAC. It is a macrolide-type antibiotic that works by stopping the growth of bacteria. It is important to note that this medication will not work for viral infections such as the common cold or flu. It is important to take this medication as directed by your doctor, and to not misuse or overuse it, as this can lead to decreased effectiveness. The daily dosage and optimal timing of this medication will depend on your specific condition, so be sure to follow your doctor's instructions carefully. When taking azithromycin tablet, you can take it by mouth with or without food. If you experience stomach upset, it's okay to take it with food. To prevent infection, your doctor may direct you to take this medication once a week on the same day each week. Make sure to continue taking it until your doctor says to stop. If you are treating an infection, your doctor may direct you to take this medication once daily. Make sure to continue taking it until your doctor says to stop. Stopping the medication too early may result in the infection coming back. Let your doctor know if your condition doesn't improve or gets worse. For the best results, take this antibiotic at the same times every day to help you remember. Also, remember that antacids containing aluminum or magnesium may decrease the absorption of azithromycin if taken at the same time. If you take an antacid that contains aluminum or magnesium, wait at least 2 hours before or after taking azithromycin. Some common side effects of azithromycin include stomach upset, diarrhea/loose stools, nausea, vomiting, or abdominal pain. However, many people using this medication do not have serious side effects. It's important to tell your doctor right away if you experience any serious side effects, such as changes in hearing or vision, difficulty speaking or swallowing, muscle weakness, signs of liver problems, or severe dizziness. Also, seek medical help immediately if you have fast/irregular heartbeat or fainting. In rare cases, this medication may cause a severe intestinal condition called C. difficile. If you develop persistent diarrhea, abdominal pain, or blood/mucus in your stool, contact your doctor immediately and avoid using anti-diarrhea or opioid products. Prolonged use of azithromycin may result in oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth or a change in vaginal discharge. Although very rare, a serious allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as fever, new or worsening lymph node swelling, rash, itching/swelling, severe dizziness, or trouble breathing. It's important to continue watching for allergic reaction symptoms for several days after your last dose. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed. Before taking azithromycin, make sure to inform your doctor if you are allergic to it or other antibiotics. Also, let them know about any other allergies you may have. It's important to talk to your pharmacist for more details. Before using this medication, tell your doctor about your medical history, especially if you have liver or kidney disease, or a certain muscle disease called myasthenia gravis. Azithromycin may affect the rhythm of your heart, which can cause serious symptoms that need immediate medical attention. The risk of this condition may increase if you have certain medical conditions or are taking other drugs that can also affect your heart rhythm. Low levels of potassium or magnesium in your blood may also increase your risk of heart rhythm problems. It's important to talk to your doctor about using azithromycin safely, especially if you are taking certain drugs or have conditions such as severe sweating, diarrhea, or vomiting. Azithromycin may also affect the effectiveness of live bacterial vaccines, so make sure to inform your healthcare professional if you are using azithromycin before getting any immunizations or vaccinations. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially the risk of heart rhythm problems. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. Additionally, if you are breastfeeding, consult your doctor before using azithromycin. It's important to be aware of potential drug interactions with azithromycin. This medication can affect how other medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription, non-prescription, and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. It's also worth noting that there are many other drugs that may affect the heart rhythm, QT prolongation, including amiodarone, chloroquine, disopyramide, dofetilide, dronedarone, hydroxychloroquine, ibutylide, pimazide, procainamide, quinidine, sotalol, among others. So, it's important to discuss any concerns with your healthcare provider. If you or someone else has taken too much azithromycin and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Do not give this medication to anyone else. This medication has been prescribed specifically for your current condition. Do not save it for a future infection unless your doctor instructs you to do so. If you forget to take a dose of azithromycin tablet, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take double the dose to make up for the missed one. Remember to store your azithromycin tablets at room temperature, away from light and moisture. It's best to keep them in a dry place and not in the bathroom. Make sure to store all medications in a safe place, out of reach of children and pets. When it comes to disposing of your azithromycin tablets, do not flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.